Hi everyone, thank you so much for joining us. We are Mehtamorph and we are trying to make some kids' lives better. Some of them don't have much of a choice when it comes to posture. And today we're going to try and change that. And we want to introduce you to Nora, and she's our little hero. You can see how happy she is wearing that little cape. And just like any other hero, she has a very powerful enemy. She has a nemesis she has to fight against. And in her case, it's idiopathic scoliosis. And it's an irregular curvature of the spine in every axis, and doctors don't know what causes it. So in a regular spine, it's completely centered all throughout the body. However, with idiopathic scoliosis, it can go from side to side or maybe curve on into itself, and that causes a lot of problems. It can cause physical deformity, chronic pain, or maybe press on your lungs and make it hard to breathe, or maybe press on your heart until it stops. So it can be deadly. In Nora's case, her spine started with 37 degrees of deviation at the time of diagnosis, and in less than a year, it progressed to 58. And you can see it here on her x-ray, how drastic that is and how much that must hurt. We've consulted with a lot of doctors and spine specialists, and they've told us that a curve that progresses more than 1 degree a month is considered severe. Hers progressed more than 20 in less than a year, so they had to do something about it. They had to save this girl. And that's why they went with metacasting, which is the go-to treatment for scoliosis in children. And it requires encasing the whole torso in a cast. And you can see it here where it goes all around from her back and it comes up in the front and it grabs all around her chest. And these tiny spikes over here generate the pressure so that she can have her spine be straight and get corrected. This metacast is set on these kinds of tables, and it requires general anesthesia. And you can see her here. She is hanging from her arms and from her legs, and her whole chest and her whole torso is on the air. And that's because doctors need to mold the cast by hand. And you have to trust your doctor because he has to feel how much pressure to put. He doesn't know it. So based on his expertise and the x-rays, he has to guess how much pressure he needs to put to correct the curvature. And the only way to know if it works is a couple of days after when they get another x-ray to see if it's actually working. Because sometimes they can put on too much pressure and it makes it even more difficult to breathe. Or maybe they don't put enough pressure and they're not correcting anything, so they have to do this over again. And that requires anesthesia again. These casts only last for around 8 to 10 weeks, maybe. So you would have to have 5 or 6 casts a year. So just imagine that. Nora used these kinds of casts for approximately 3 years, and that rounds up to about 26,300 hours of her life in a cast. Just picture that. 3 years of your life inside of that cast. And that's when we said we had to do something. We have to make this kid's lives better. It can't be all trauma and sadness. And so we went to a drawing board and we started thinking and designing. And that's how Cocoon came to be. A cleaner, breathable, more comfortable corset precisely adapted to the child's body. And we call it Cocoon because to us is like the little worm that comes and capsules itself in a cocoon. And it stays there for a couple of weeks and then it comes out as a butterfly. We want this for kids to be a place where they can grow and transform into their best selves. And that's only possible with additive manufacturing, because we can make a solution adapted to every child. The same thing doctors do with their hands, molding the cast. We can do it with a computer and a 3D printer. And it's perfect every single time. We don't have to think about how much force or how much pressure, or if the measurements are right, because we've calculated it all in the computer. And that's also because our design is entirely built in Grasshopper. And this allows us to adapt it immediately to every child's body. It doesn't matter if your scoliosis type is an S type and it curves like so, or maybe it's a C type and it curves only on one side. We only need a 3D scan and we only input it on our Grasshopper and it's ready to go. We would just need to adapt the pressure points with the info our doctors give us, and it's done. We thought about the materials as well and the properties that they have, and we chose TPU and diamond lattice structures because they give us structural rigidity and they don't compromise on comfort. We gave Cocoon a thicker outer layer, an outer skin, so that it protects the corset, because they're kids. They are gonna fall, they're gonna play, they're not gonna be careful with it. And we don't want them to. We want them to have a childhood as normal as possible. And on the inside, it's softer, it's more comfortable for them. It also has a diamond lattice structure, as I mentioned before, which would act as a type of mattress, as your bed's mattress, which is soft when you touch it, but when you press on it, it generates resistance. And that way you can sleep and you don't fall. In the end, we also decided on giving it a chemical polish finishing so that it's softer to the touch and it's better to have it on your skin all day. One of the things we thought most about was airflow, because that's one of the main pain points in using a cast. Air doesn't flow through and it becomes itchy and uncomfortable. So that's why we built all these tiny holes around the structure, so that your skin can breathe and you can perspirate easily. It also reduces material waste because we only use what we need. Another thing we thought about was how to adjust it, because we wanted it to grow with the kids. The traditional cast only lasts around 8 to 10 weeks, but Cocoon can last so much longer because it's adaptable. And that's only thanks to the BOA fit system. We have 2 fastening dials on the corset and they're really simple to use. You just push on the dial and turn it to tighten it, or turn the other way around if you want it to make it a little bit looser so that it fits more comfortably when the child grows. And if you want to take it off, you just pull and that's it. You can bathe the child or change their clothes with ease, no problem. And this is why additive manufacturing makes sense for us. It doubles the lifespan of the corset. Instead of having 5 or 6 casts per year, you would only have 2, maybe 3 corsets a year. It's so much more comfortable to use. It's also flexible and adjustable. It's hygienic. You can bathe the child or maybe even clean the corset. It's much less wasteful because we only use the materials we need. And we don't have to make as many of them as the casts do. And also air flows through, so it's much more comfortable to wear it all day. And our process is completed in only 4 steps. You just need to scan the child and input the data into our model system. Once we have the measurements and the data our doctors give us from forces and the x-rays, we can go into production and start printing the corset. And in the end, the finishings. We can choose colors and the chemical polish coating, chemical polish finishing, sorry. And we could even think about maybe adding a hydrophobic coating in the future so that these kids can go to hydrotherapy or maybe spend a day at the pool, because that's what we want in the end. We want these kids to lead a normal life. We want to make scoliosis less traumatic and more comfortable for children. And you can see how happy Nora is taking the last of those awful casts off. And this is Mehtamorph. Thank you so much for joining us, and you can contact us via email, Instagram, or LinkedIn.